evening, everyone, and welcome to today's wonderful evening. I hope you're all geared up, psyched up, emotionally vibrant to attack the upcoming NEET PG exam. Today, I'm going to give you a few bullets. Bullets are quick revision points just to spice up your preparation, because on the Incus app, there are 800 hours of video content, almost 2000 HD videos. And that's more than enough for you to do the revision. But still, every day I come online, spend time with you, become your classmate, roommate, benchmate, tablemate, and study along with you. So today we are going to do things a little different. We call this as bullets. How fast we can be able to revise. Each of you should contain your own 200 pages notebook. In that, you need to write down some of the points that are easy to forget, but definitely asked in the entrance. So that is what I'm going to do for all of you in the next half an hour. Today is going to be a short class. Kalin, Bhaiya, Shailja, and many more who are all online, thanks for joining today's evening session. So, Doctor, yes, let us see what are all the pathology bullets that we have. Yes, let us see the pathology bullets. Yes. So basically, what are bullets? Bullets are the common questions which are asked in the exam, short questions that you need to definitely master. So let us make the great beginning, Doctor. How many bullets are we going to shoot in the next half an hour? Now, in the cell injury, what is the earliest organelle to get affected? Always remember mitochondria. So, in the cell injury, reversible, irreversible injury, what are the differences is the favorite topic of the examiner in pathology. So today it is all pathology bullets. So myelin figures are the ones, what are they made up of? They are made up of phospholipids. So typically if you take, for example, in this case, Fabry's disease, the arterial smooth muscle cells are showing foam cells, empty cells. And you are able to see the myelin figures in the smooth muscle cells by electron microscopy. And these myelin figures are made up of phospholipids. Is going to be your answer in the tomorrow's NEET PG. Good to see Adi Narayana, Swapnil, and many more who are all online. Great. Now, what is the sign of irreversibility of the cell injury? It is the inability to reverse the mitochondrial dysfunction and the loss of the membrane function, which is considered to be the sign of irreversibility. Now, what is the earliest sign that you see in reversible cell injury? Your parrot-like answer is hydropic change, or otherwise the swell becomes swollen, the cell becomes swollen. So this hydropic change is considered to be the earliest change, is what you need to remember. Now quickly, different types of necrosis, 2-3 points about it, definitely ask you a question. But yeah, most common type of necrosis क्या होता है? Coagulative. Typically in the coagulative necrosis, suppose this is the cell, you have a nucleus. Typically, there is a loss of nucleus, but a cellular outline is preserved. That is the reason it has got a tombstone appearance, is what you need to remember. Now, commonly, what is the cause of the coagulative necrosis, doctor? Ischemia is the underlying cause. The heart, liver, kidney, classical organs where you see coagulative, but not in brain. So, brain में क्या होता है? Liquefactive necrosis, where there is an enzymatic destruction. So, liquefactive necrosis, typically where do you see? Abscess, pancreatitis is another example of liquefactive necrosis, is what you need to remember. Now, caseous, all of you know, it is a cheese-like material where there is a combination of the coagulative and liquefactive. Tuberculosis, it is classical, but also in syphilis, histoplasmosis, coccidomycosis, caseous necrosis should be remembered. So, Khalil Bhaiya is asking, sir, any tips for INI CET? Whether it is FMGE, NEET PG, INI CET, सब कुछ एक ही है डॉक्टर. राम हो, अल्लाह मियाँ हो, नहीं तो लॉर्ड क्राइस्ट हो, बात तो एक ही है. There are 953 topics, very high-end topics, and about 50,000 MCQs that you need to master. The day you master it, any entrance exam will fall on your feet. Please remember. So please don't forget to download the Incus app, doctor. Just for 999 rupees में आपको 800 hours of video content, nearly 2000 HD video lectures, 60,000 MCQ question bank, 60 full-scale grant tests, 35,000 slides of PowerPoints of notes, and daily live classes, everything just 999 rupees for 3 years. दुनिया में कोई भी इतना सस्ते में नहीं मिलेगा आपको ज्ञान. So please tell also your friends to join, right? And another good part is, so Khalil Bhaiya is asking, sir, Incus contains question bank very much. It has got a enormous question bank, and also questions accompanied by explanatory answers. You can be able to bookmark the MCQs and do the last moment revision. You can play quiz tournaments. Everything in the world is there in the Incus quiz app, doctor. Today night we are launching the next version of the Incus. The moment we launch the next version of the Incus, the highlight of the next version of the Incus is this 60,000 MCQs, we are giving it like flashcards for you to play. That is another highlight for no extra price. Same 999 rupees, 3 years. 1 rupee per day is your investment. Now, doctor, fibrinoid necrosis क्या होता है? There is a leakage of fibrinogen from the vessels. Polyarteritis nodosa, Ashcroft body syndrome, rheumatic heart disease, malignant hypertension. इन सारे चीजों में होता है fibrinoid necrosis. So, भैया, gangrenous necrosis क्या होता है? In gangrene, there is a superadded putrefaction, like Fournier's gangrene in scrotum. Noma means gangrenous lesion in the vulva or mouth. Cancra moris. So dry gangrene is similar to coagulative. Wet gangrene is due to liquefactive. Wet gangrene occurs whenever there is any secondary infection, is what you need to remember. Now, doctor, thank you, sir. Can I buy instantly now? Why not? Please call or WhatsApp. Please call or WhatsApp 9000868 You get an access. There is an Android app and also web access. Shortly, we are going to launch the iOS also, but currently Android and web you have. Now, doctor, one of the favorite topic of the examiner, apoptosis. Definitely एग्जामिनर पूछेगा. इसमें कैश स्पेसेस का नंबर्स जो होता है, you have to write somewhere and remember, because tomorrow definitely they will ask. Cache space 8, 9, 10 is initiator cache space. Cache space 3 and 6 is executioner. Executioner cache space in the apoptosis is what you need to remember. Now, if you look at the cytochrome C, doctor, you have a cytosolic cytochrome C, which mediates apoptosis. Mitochondrial cytochrome C is what we learned in biochemistry. That is electron transport chain. But cytosol maybe you have cytochrome C that is associated with the apoptosis is what you need to remember. Now, one of the favorite questions of the examiner. Bhaiya, apoptosis ka most characteristic feature, you should remember, it is the condensation of the nuclear chromatin. Nucleus के अंदर chromatin रहता. It is called heterochromatic. Whenever it is in a very condensed form. So it is a condensation of the nuclear chromatin, which is most characteristic of the apoptosis is what you need to basically remember. Sometimes there can be a programmed cell death, which is normally called apoptosis, but it can be cache space independent. Then you call necroptosis is what you need to remember. Now comes the favorite bullet point. All these bullets, examiner के temple में लगा के bullet मारना, ठीक है? So now, what are anti-apoptotic, pro-apoptotic, sure short question? But we will all forget. We think NEET PG topper means some brainy guy. No, doctor, nothing brain. The NEET PG topper is a Fevicol guy, not a brain guy. Fevicol लगाओ, टेबल के ऊपर बैठ जाओ, निकलना नहीं, पढ़ना. That is the only way. So anti-apoptotics, BCL2, BCL-XL, MCL1, they increase the inhibitors of the apoptosis protein and they will antagonize the apoptosis. Pro-apoptotic are BAD, BIM, BID, PUMA, P53, NOXA. They increase the cytochrome C. Where? In cytosol, not in mitochondria. And they are considered to be pro-apoptotic. Now, what is the effect of steroids? In corona, we are giving steroids, right? So, what is the effect of glucocorticoids on steroids? Steroids induce apoptosis. Sex steroid inhibit apoptosis. That is what you need to remember. Now, what is the way you detect apoptosis? मैं इतने बार आपको बोल रहा हूं apoptosis. Tomorrow NEET PG, INI, CET, DAM, any exam. Apoptosis के ऊपर क्वेश्चन नहीं है तो मेरा नाम मुरली भरद्वाज नहीं है, बराबर? So make it a point. You eat apoptosis, you drink apoptosis, you breathe apoptosis. Chromatin condensation is a way to detect the apoptosis. Using hematoxylin, fulgen, ecridin, estimation of cytochrome C, activated cache space, estimation of annexin 5. So apoptotic cells, they all express phosphatidylserine on the outer layer of their plasma membrane. Because of this expression of the phosphatidylserine, they are recognized by the dye annexin 5. So annexin 5. Similarly, we use a technique called tunnel, TUNEL. That is TDT mediated DUTP nick and labeling. Nick and labeling. Tunnel. कल के एग्जाम में tunnel को याद रखें. Ultimately, when you become cardiologist, neurologist, nephrologist, all these don't matter, but still, to get top rank, all these things matter. So the DNA breakdown occurs at specific sites whenever there is apoptosis, and that can be detected in a step-ladder pattern on a gel electrophoresis or by doing the tunnel. Tunnel will help you to identify the step-ladder pattern is what you need to remember. So quickly tell me 5 points about the apoptosis. Bullet 1, 2, 3, 4. What are the bullets about apoptosis? Apoptosis can be physiological, pathological. It is important for homeostasis, to eliminate the pathogens, to eliminate the tumor cells. Apoptosis affects single cells, necrosis affects multiple. The cell size is shrunken. Apoptosis is an active process, not a passive. Apoptosis has no inflammation. If there is inflammation, you call necrosis. In apoptosis, plasma membrane is intact. In apoptosis, step-ladder pattern is seen. Whereas necrosis क्या होता है? Necrosis जब भी होता है physiological नहीं होता. Necrosis always is pathological. In necrosis, typically there is a disruption of the cellular homeostasis, that is ischemia, hypoxia, poisoning, etc. And it affects groups, contiguous groups of cells. And there's a hydropic swelling because of the injury. So cells is increased, not shrunken. It is passive. Inflammation is there. Plasma membrane is disrupted. And there is a smear pattern, not step-ladder, on the electrophoresis. Bhaiya, next bullet that you are going to forget. Where do you see Samoma bodies? This you have to write somewhere and keep. Most PG is some stupid way to remember, but we have to. Meningioma, papillary carcinoma of ovary, papillary carcinoma of salivary, papillary carcinoma of thyroid, prolactinoma, papillary type of renal cell carcinoma, glucagonoma. You have to remember, like Venkateshwara Suprabhatam, there is no other way, but you need to remember. Pragati is saying, sir, it is blur. Is it blur for everybody or only for Pragati? Others punch? How is it? For me, it is looking high density. Pragati, maybe you need to check your internet speed, doctor. Because मैं कुछ भी नहीं कर रहा हूँ, हमारा टेक्नोलॉजी नहीं है, YouTube वालों का टेक्नोलॉजी है. No, it is fine. Good. Thank you, Khalid. Now, ankylosing spondylitis versus diffuse idiopathic skeletal hyperostosis. इसको बोलते हैं DISH, otherwise called Forestier's disease. So what is the main difference? Both of them will affect the spine. But the calcification in ankylosing spondylitis, that leads to the bamboo spine appearance. Bamboo spine, it is prominent in the anterior spinal ligament. And that looks like a flowing wax appearance on the anterior part of the vertebral body. Whereas diffuse idiopathic skeletal hyperostosis, also called Forestier's disease, it affects the spine. It is also an enthesopathy. And there is a calcification on not only anterior but also lateral aspect of the vertebrae. That is the main difference, is what you need to remember. So what is the commonest fixative which is used in the light microscopy And what is that you use in electron microscopy? One of the favorite bullet point in tomorrow's INI-CET and NEET PG exam. Electron microscopy में होता है glutaraldehyde. Light microscopy में 10% buffered neutral formalin is what you need to remember. So if you go to the previous AIMS exam, NEET PG exam, and the various exams, doctor, remember, stains is a favorite topic. What is the stain is a favorite topic. Please remember. Definitely आने वाला bullet point है कल के NEET PG MCQ. Melanin, meson fontana, lipids, oil redo, and pastain for glycogen, mucin, mucoprotein, glycoprotein, and fungi. Gomery, methenamine, silver stain for the fungi like Cryptococcus, Coccidioides, and Pneumocystis carinii. We use gomery, methenamine, silver stain. This important bullet point you should not forget. Now, complement cascade is the next favorite topic, doctor. It's a favorite topic of the examiner. Don't forget. So, in paroxysmal nocturnal hemoglobinuria, what will happen? Complement mediated hemolysis will occur. Complement mediated hemolysis occur in PNH. So C5 becomes C5A and that mediates the hemolysis in PNH. To prevent that, what is the monoclonal antibody used, doctor? Eculizumab. Eculizumab is a favorite bullet point of examiner. Now, all cytokines are not pro-inflammatory. There are cytokines which are anti-inflammatory. Adenopectin, interleukin 10, interleukin 6, interleukin 4, TGF, tumor growth factor, beta. These are considered to be anti-inflammatory cytokines is the favorite bullet. Selectins, integrins. Whether we go for USMLE, INI-CET, or any damn exam in the world, this is the favorite topic, doctor. Selectins are important for rolling. Roll. Integrins are important for adhesion. So typically this is a vascular endothelium and the cells are passing. So the inflammatory cells rolling के लिए selectin होना, integrin होता है adhesion के लिए. So whenever cytokines are released, they mediate inflammation. So what is the hallmark of this cytokine mediated acute inflammation? It is the expression by the endothelium, the E-selectin. So selectin family includes E-selectin, L-selectin, P-selectin. In that, the endothelial expression of E-selectin is considered to be the hallmark of the acute cytokine-mediated acute inflammation is what you need to remember. Then, whenever inflammation is happening, the inflammatory cells will migrate from the vessel into the surrounding tissues. So this transmigration को बोलते हैं diapedisis, and for that you require PCAM molecule, and this is also CD31, another name for CD31. So what are the chemotactic cytokines, chemotactic agents? Is a favorite question of examiner. Among the complements, C5A is chemotactic, Leukotriene B4 is chemotactic. Interleukin 8 is chemotactic. So don't forget this chemotactic substances were the favorite question of the examiner. Then what are the opsonins? Is another bullet point. All these bullets, there are totally about 60,000 bullets that you need to ready and go and dig examiner ko shoot kar dena, right? So entrance preparation don't need years and years of preparation or 50,000 rupees, 40,000 rupees, plan A, plan B, that plan, this plan, all that is bakwas. You need only one plan, that is the plan to study every day. You need only one friend in this world to make you become the topper. That is Murali Bharadwaz. And you need only one app in the world which comes for just 999 rupees for 3 years activation. अगर आपको सीट मिल गए तो आपके जूनियर को दे दो मुफ्त में as a gift the subscription को. So 999 rupees में 3 साल 3 years. Nowhere in the world you get learning so cheaper. Now we are starting IAS exam preparation, banking exams, RRB, everything. Teachers across the country. We are going into building massive video content, original MCQs with explanatory answers, question banks, and then offer for just 999 rupees. Doctor, to राजा का बेटा राजा नहीं बनेगा, वो बनेगा राजा जो हकदार है. So we want coaching, learning, topping entrances to be democratically priced, affordable, accessible for everybody. Today, technology will enable you to bring that accessibility. So once upon a time, to enter into a classroom, you need to first, there will be a guy standing at the gate and collect the fees in the coaching centers, and only will permit you to go and sit. Today, YouTube aa gaya. Hours together of knowledge is available on the YouTube, right? So knowledge is supposed to be easily available. That's the purpose of technology. C3B lectins, they're all opsonizing chemicals is what you need to remember. Now, doctor, this is a favorite question, doctor. Which is CA, which cancer? Tumor marker. All are CA. CA 125, ovarian cancer. 99, colon cancer, pancreatic cancer. CA 15.3, breast cancer. So please don't forget, doctor. Definitely पूछेगा कल के examiner. Now once more. Different tumor markers. If you take pathology में कितना आता है डॉक्टर? 10 questions आएगा. NEET PG हो या FMCE या INI CET. 10 questions में 1 question apoptosis, 1 question tumor marker. अगर नहीं है तो मेरा जिम्मेदारी. बराबर? Now, breast cancer. Alpha lactalbumin, estrogen receptor, progesterone receptor, GCDP15. For thyroid, thyroglobulin and calcitonin. For liver, alpha-fetoprotein, HbS-AG, keratin. Prostate, PSA, and PA and prostatic acid phosphatase. For mesothelioma, keratin, calcitonin, mesothelin. Germ cell tumors, alpha-fetoprotein and HCG. This is important bullet point MCQ, doctor. For endothelial tumors, factor 8 CD34. Melanoma, HMB45, S100. Oh my God. देखो कितना पट्टी मारना होता है नीट पीजी के लिए. करना पड़ेगा क्योंकि 2 लाख बच्चे लिख रहे हैं एंट्रेंस को. आप तो पहले 20,000 में अगर है तो कुछ मिलेगा. 1,80,000 people will leave unhappy after taking entrance. 70,000 नए बकरे मार्केट में रिलीज्ड every year. देखो competition बढ़ रहा है. Unfortunately, all these stupid things act as a filter. Ham 56 for fibrocystic histiocytic tumors. Similarly, Desmin, smooth muscle specific antigen, myoglobin for all the myogenic tumors. So, one favorite question the examiner, by a malignant melanoma mein most specific marker HMB45, whereas most sensitive marker S100. That's what you need to basically remember. Kaleem Bhaiya is saying, sir, I am old bakra. No. I don't mean that way. Yeah. Now, doctor, what is the various intermediate filaments? What is, where do you see their expression? What is the tumor? Chalo. Bullet. Cytokeratin, all epithelial cells seen in carcinoma. Vimentin, all mesenchymal cells express it, sarcomas. Desmin, muscle cells express it, seen in leiomyoma and rhabdomyosarcoma. Leiomyoma is smooth muscle, rhabdomyosarcoma is skeletal muscle. Glial fibrillary acidic protein, GFAP, expressed normally by glial cells, astrocytoma and ependymoma. Neurofilament in the neural crest derivatives and neurons, and seen in pheo and neuroblastoma is what you need to remember. Once more, one of the favorite question, doctor, big bullet, favorite bullet of examiner. In neuroblastoma, an NSC is more specific, whereas chromogranin, synaptophysin are more sensitive. Examiner sensitive पूछ रहे हैं, specific पूछ रहे हैं, जरा देखना भैया. Now, if you look at the various neuroendocrine tumors, the neurospecific enolase, chromogranin, synaptophysin, they are the markers. Malignant melanoma अगर लिया जाए तो HMB45, S100, Vimentin are expressed. HMB45 is present on melanosomes, that's the reason very specific. S100 is more sensitive but not specific. Why? Because S100 is also positive in Langerhans cell histiocytosis, neural tumors, sarcomas like liposarcoma, chondrosarcoma. Now, how about neurofibroma? Neurofibroma is a neural tumor. It shows S100 and GFAP. And malignant बन गया तो neurofibroma. Neurofibroma benign होता, malignant भी होता, fibrosarcoma होगा. So अगर fibrosarcoma बन गया तो it loses the expression of S100. S100 expression is gone with the sarcomatous transformation. Neuroblastoma, it expresses the non-specific enolase, chromogranin, synaptophysin, but non-specific, neuron-specific enolase. It is more specific, whereas chromogranin and synaptophysin are more sensitive. Then angiosarcoma, factor 8, Vimentin, CD34. Shanti. Somehow we need to remember that. Hussein Wali is saying, sir, please provide explanation also for MCQs on Incus for correction answer. It is only correct answer with green and no explanation. See, doctor, every quiz के बाद अगर वो history में चले जाता, history में जाने के बाद वो PowerPoint रहता attached, उस PowerPoint में उस question और explanation के साथ PowerPoint available है. Please check that. If you are not able to get it, please call 9000-868-356, our helpline. Don't worry. And now we are introducing a new feature called flashcards. Tonight we are uploading one new version of the Incus app, flashcards. A flashcards में 60,000 multiple choice questions with explanations को we are providing it like flashcards. क्वेश्चन देखो, आंसर सोचो, टिंग मारो, देख लो करेक्ट आंसर। अगर डाउट है तो उसको बुक मार्क कर लो। लास्ट मोमेंट में ओनली बुक मार्क्ड थिंग्स व्हिच यू आर नॉट श्योर, उसको रिवीजन करो। आराम से 60,000 एमसीक्यू खेलते खेलते आप खत्म कर सकते हैं। So what is important, doctor? What coaching centers provide you is not important. How much of that you can read yourself, remember yourself, and reproduce in tomorrow's exam. That is more important. If some coaching center says, I provide more, and more, all that more will only putrefy the brain, right? So what is really required is not more than these 60,000 most common MCQs and their explanations. That is what you need to do the revision. दोस्तों के साथ बैठ के खेलते खेलते. You don't need even videos also, actually speaking. It's boring to listen somebody's videos. It's more easier to read sometimes than listening videos. But still, हमको obsession रहता, वो भी ले लिया, ये भी ले लिया, वो plan ये ले लिया, my plan B ले लिया. कुछ ले लिए तो मजा आएगा. अरे कितना पढ़ोगी? That is important, right? So that is the reason flashcards, we are adding that new feature into the Incus app for no extra price. For the same 999 rupees, we give what all that we can give you the best things. Similarly, now we are discussing these points. ये सब वीडियो ले जाके PowerPoint के साथ Incus app में डाल देंगे और वहां भी आपको मिलेगा ये पूरा PowerPoint और सब कुछ. So कितना मटेरियल इंपॉर्टेंट नहीं है डॉक्टर, कितना हमारे दिमाग में घुस रहा है, that is important. So now the next question is one of the favorite thing that you need to write somewhere and keep, doctor. Definitely आएगा ये question. Subepithelial, subendothelial, basement membrane and mesangial deposits in glomerulonephritis. Once more, 10 MCQs आएगा pathology में, one topic definitely from glomerulonephritis. Subepithelial, typically in post-critical glomerulonephritis, membranous glomerulonephritis, rapidly progressive glomerulonephritis, some cases, and type 1 MPGN rarely, subepithelial. But type 1 MPGN may more commonly is subendothelial. That is the reason you need to remember. Actually, SLE also subendothelial deposits. Then MPGN type 2 may, it will go and deposit on basement membrane. Similarly, membranous glomerulopathy also, basement membrane. Then mesangial deposits are seen in IgA nephropathy, Henoch-Collin purpura, good pastures disease, you find mesangial. So will you promise me that इस टेबल को आप दिल में लगा के कल के एंट्रेंस में जरूर राइट आंसर करके निकलना. So if there is an entity called benign familial hematuria, पूरा फैमिली खानदान में सबको हेमेटूरिया दिखता है, but it is benign, it doesn't progress into CRF. It is the thin basement membrane disease which is the most common cause of the benign familial hematuria is what you need to remember. Now let us take few comments on Berger's disease. एक छोटा बच्चा ने अपर रेस्पिरेटरी इंफेक्शन हो गया, 2 दिन के बाद पेशाब में खून निकल रहा है. डॉक्टर साहब पेशाब गए तो खून निकल रहा है. There is a hematuria. 2 days back there is a upper respiratory infection, sore throat. Not 3 to 4 weeks back. If it is 3 to 4 weeks back, and today if there is a hematuria, then that is post-streptococcal glomerulonephritis. But just 48 hours back, sore throat and immediately developing, that is called Berger's disease. The most common cause of the glomerulonephritis in adults, what is your answer? Berger. Most common cause of benign recurrent hematuria. Benign recurrent hematuria. Berger. It is called benign because it does not progress into chronic renal failure. There is an increased IgA in mesangium. Hematuria occurs 3 to 4 days after throat infection. There is an increased chance of recurrence, but complement levels are normal, unlike PSGN, where there is a hypocomplementemia in case of post-streptococcal glomerulonephritis is what you need to remember. Now, doctor, if you do light microscopy, there will be foam cells in the interstitial cells, where in Alport syndrome, I'm talking about the next condition, Alport syndrome. 4 points you should remember about Alport syndrome. Foam cells in interstitial cells. Then in the glomerular basement membrane, there's a splitting and the lamination of the lamina densa, which is called the basket weave appearance. Basket weave appearance. And the glomerular and tubular basement membrane, alpha 5 staining is absent. So that condition is Alport. But yeah, Alport क्या होता है? Alport syndrome is a nephritic syndrome, not nephrotic. Nephritic picture, मतलब hypertension, hematuria, etc. Kidney, ear, and eye are involved. Problem in alpha 5 chain of the collagen type 4. A defective glomerular basement membrane synthesis. Wherever the organs there is a collagen, there is a Alport syndrome का effect गिरता है. Typically, Alport syndrome is in the males, age of 5 to 20, presenting with microscopic or gross hematuria, narrow deafness, and what are the ocular features of the Alport, doctor? Posterior cataract, lens dislocation, corneal dystrophy. They are all the part of the Alport syndrome. Now, once upon a time, we used to say nephrotic syndrome, most common cause. Children, minimal change disease, and adults, membranous nephropathy, we used to say. But now, the commonest cause of the nephrotic syndrome is FSGS, focal segmental glomerulosclerosis. It is focal, only some glomeruli are affected. Segmental, only a part of the glomerulus is affected. That is FSGS. So, in the FSGS, there are so many varieties. Most common variety, NOS variant. Worst prognosis, collapsing variant. Typically, collapsing type of FSGS is typically found in the case of the HIV. Best prognosis is there for the glomerular tip lesion type of FSGS. Please don't forget these very important bullet points, doctor, whether you like nephrology or you don't want to be a nephrologist, but you need to remember all this. So it is the focal disruption of the visceral epithelial cells. So basically, if you look at the Bowman's capsule, you have parietal epithelial cells and visceral epithelial cells. Parietal epithelial cells, when they undergo proliferation, that is called crescent. They form a crescent. So crescentic glomerulonephritis में crescent क्यों बनता है? It is a proliferation of parietal epithelial cells. Then there are visceral epithelial cells, which are also called podocytes. And it is the disruption of this visceral epithelial cells is considered to be the hallmark of the focal segmental glomerulosclerosis is what you need to basically remember. Now, the next favorite question. Does a nephrotic syndrome in syphilis, schistosomiasis, hepatitis B, toxoplasmosis, but what type of nephrotic syndrome? It is membranous glomerulonephropathy. Membranous is responsible for nephrotic syndrome if it is syphilis, schistosomiasis, or hepatitis B in children. Whereas membranoproliferative type of glomerulonephritis, if it is hepatitis B in adults or in toxoplasmosis is what you need to remember. So now, doctor, if you look at the MPGN, membranoproliferative glomerulonephritis, it can be primary, it can be secondary. Secondary can be HBV, HCV, HIV, CLL, lymphoma, etc., etc. They are the causes of secondary MPGN. But primary MPGN, idiopathic MPGN अगर लिया जाए तो इसमें होता है टाइप 1, टाइप 2, टाइप 2. Very good. Now, 2-3 points about type 1. Type 1 में immune complexes are both the classical, alternative, complement pathway. Type 1 में it is the subendothelial and mesangial immune complex deposits. And there is a granular pattern of C3, IgG, C1q and C4 is what you need to remember. Whereas type 2 MPGN का दूसरा नाम होता है dense deposit disease. It is not classical, only alternate complement pathway immune complexes are seen. There is a dense deposit where in the glomerular basement membrane inside it, there are the intramembranous deposits in case of type 2. Type 2 MPGN is what you should remember. Not only granular, but also there is a linear pattern of C3. And there is no IgG in type 2. Yes, IgG will be there in type 1 MPGN. This is very, 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 very important point to remember. Abhi aa gaya. Tram track appearance. Tram track appearance. Where do you see tram track appearance? Typically, in case of MPGN, is what you need to remember. Now, if you look at the various congenital conditions that lead to the presentation of nephrotic syndrome, doctor, there are a few things that you should not forget. NPHS1 gene, NPHS2 gene, and the gene encoding the podocytes actin binding protein alpha actinin 4. These three, अगर जेनेटिक्स में कुछ गड़बड़ हो गया तो जो पैदा होगा उसको नेफ्रोटिक सिंड्रोम होगा, congenital nephrotic syndrome. NPHS1 gene lead to a hereditary form of congenital nephrotic syndrome called Finnish type. NPHS1 gene encodes for the protein nephrin, which is a component of the podocyte foot process. NPHS2 gene, it is for the protein podosin, and the mutation will lead to steroid-resistant nephrotic syndrome, NPHS2. Congenital nephrotic syndrome of Finnish type, NPHS1. That is what you need to remember. Similarly, NPHS2 also lead to autosomal recessive form of FSGS. That's what you need to remember. Whereas alpha actinin 4, it leads to autosomal dominant form of FSGS. And C6, it is the adult onset FSGS. So these important causes of the nephrotic syndrome, you should not forget for your tomorrow's exam, doctor. Now, what are the various types of... Now, the next favorite topic of the examiner, doctor, amyloidosis in pathology is a bullet topic. Bullet जाके सीधा सीने में घुस जाएगा अगर एग्जामिनर को मालूम पड़े कि आप amyloidosis weak है बोले तो. Your competition will crush you. Certain common topics if you do wrong. Now, what are the two types of systemic amyloidosis, doctor? Primary, secondary. Now, primary में क्या होता है? It is the immunoglobulins light chain deposits systemically, and that is called AL amyloid. AL amyloid is responsible for primary. So any plasma cell dyscrasias like multiple myeloma lead to primary amyloidosis. Secondary amyloidosis is because SAA protein deposits systemically. So AA is secondary, AL is primary. What will you remember tomorrow's exam? Gadwad Nayona. You can remember Alps. Mountain, Alps are there. No? AL is primary. The other one automatically becomes secondary. So any chronic inflammatory condition, the SAA is an acute phase reactant, serum amyloid protein, and that lead to chronic inflammation, malignancy, familial Mediterranean fever, etc., etc. So, Bhaiya, what is familial Mediterranean fever? Familial Mediterranean fever, chronic inflammatory condition. So basically, there is a dysfunction of neutrophils that lead to systemic amyloidosis, and patient will have very high SAA. So secondary amyloidosis, it is responsible. There is a fever and a lot of serositis. So the heart can be involved, gut can be involved. Because the involvement of the heart, it looks like myocardial inflammation, myocardial infarction. Because gut is involved, it can look like appendicitis. ये सब होता है familial Mediterranean fever. Now, what are the classic findings of systemic amyloidosis? First of all, you should know what is the organ most commonly involved of all the organs in the body in the systemic amyloidosis? Kidney. Kidney is the one which is most commonly involved. So it can lead to nephrotic syndrome. Similarly, restrictive cardiomyopathy because of the cardiac involvement. Hepatosplenomegaly, malabsorption, macroglossia. Macroglossia, where do you find? Macroglossia in systemic amyloidosis is what you have to emphatically remember. Now, doctor, how do you diagnose amyloidosis? You need to do tissue biopsy. There is no other way. Usually from rectum or abdominal fat pad, it will be Congo red positive. That's what you need to remember. Now, 1-2 points, bullets about senile cardiac amyloidosis. It is because of the non-mutated transthyretin, which goes and leads to, after albumin, the second most common protein that you see in the blood is transthyretin. Usually, senile cardiac amyloidosis, it is senile. They are mostly asymptomatic. And it is seen in 25% people more than 80-year-old. In them only you will see senile cardiac amyloidosis is what you need to basically remember. So what is familial amyloid cardiomyopathy? It is a form of local amyloidosis due to deposition of the mutated serum transthyretin in heart leading to restrictive cardiomyopathy is what you have to remember. So is there a relation between amyloid protein and type 2 diabetes? Yes, sir. Pancreas produces a lot of insulin. One of the byproduct is amylin, which is also produced in the islets of pancreas, and that can lead to development of amyloidosis, which is seen in type 2 diabetes. Similarly, Alzheimer's is also one of the outcome of amyloidosis because there is a beta amyloid precursor protein, BAP. Beta amyloid precursor protein. It is there on the chromosome 21. It makes A beta amyloid plaques. So that is the reason all these Down syndromes they have Alzheimer's by the time they reach 40 years of age. Because this BAP, beta amyloid precursor protein, is there on chromosome 21. Similarly, dialysis leading to amyloidosis. Yes, sir. There is a beta 2 microglobulin, which is structurally, it supports the MHC class 1 on the cell surface. And in the dialysis, this beta 2 microglobulin is not filtered well, and that goes and builds in the joints and lead to the development of amyloidosis in the people who are undergoing dialysis, is what you need to remember. Similarly, medullary thyroid cancer, can it cause amyloidosis? Yes, sir. It can lead to local amyloidosis in thyroid. In medullary thyroid cancer, there is an overproduction of calcitonin. And calcitonin is the underlying cause. That is all the story on amyloidosis. So today only, doctor, make it a point to go back to Incus app and please bookmark the videos on amyloidosis and Kalke NEET PG में definitely amyloidosis आने वाला है. Now, chronic granulomatous disease में catalase positive organisms are very common. So what are the 5 common catalase positive organisms that you see in chronic granulomatous disease? Staph aureus, Pseudomonas cepacia, Serratia marascens, and Nocardia and Aspergillus. They are the catalase positive organisms of the CGD, is what you need to remember. Now let us look at some spotters, image-based questions. So what you are seeing here, doctor, exotrophy of bladder. There's a red mucosa of the urine bladder seen protruding through a defect in anterior abdominal wall. Now what is this you are seeing? It is cystosoma hematobium. Why not Manson? It is this terminal spine, which is the hallmark, instead of a lateral spine. If there is a lateral spine, that is cystosoma mansoni. Now, what is this organism commonly leading to UTI? It is the gram stain of E. coli, where you are able to see the gram-negative rods that characterize the E. coli. Now, in the bladder, what you are seeing here, we are seeing a urothelial tumor. Yes. Urothelial carcinoma. There is a papillary exophytic mass arising from the mucosal surface of the bladder, and transitional cell carcinoma is the older term for the urothelial carcinoma. Now, this kind of hemorrhagic, this is the interior of the bladder which is showing hemorrhagic cystitis. You should remember adenovirus can cause hemorrhagic cystitis, and cyclophosphamide therapy is what you need to remember. Now, all these eosinophilic staining histiocytes which you are seeing, they are seen in malakoplakia of the bladder, and these are called as Michaeli-Gutmann's bodies. Is another bullet point you need to remember. Tomorrow's favorite image-based MCQ. And typically they stain positive for iron and calcium. So what is malakoplakia basically? Normally, bacteria are killed by fusing the phagosome and lysosome by the histiocytes. Any defect of this phagolysosomal killing of the bacteria by the histocytes, most commonly E. coli, that lead to malakoplakia. It's very common in the people who undergone renal transplantation, malignant lymphoma, those on systemic steroids, diabetes, and that lead to erythematous papules, subcutaneous nodules, and ulcers, is what you need to remember. Now, before we call it a day, doctor, let me once more. Favorite question of the examiner. How do we piss? How is bladder controlled? is the favorite topic. If you want to micturate, your bladder should contract, ditusar. For that, parasympathetic will function. Parasympathetic कहाँ से आएगा? S2, S3, S4, and same time it lead to relaxation of the internal sphincter, parasympathetic. Whereas if your bladder need to be filled, not contract, filled, ditusar should relax. That is mediated by sympathetic. Sympathetic comes from L1, L2, L3, and that lead to constriction of the internal sphincter. Whereas the external sphincter जो होता है, it is under the voluntary control, is what you need to remember. So, doctor, with that, we come to an end of the today's wonderful evening. हम रोज मिलेंगे, रोज पढ़ेंगे, खुशी से पढ़ेंगे, because there is no other time more happier than the time when we prepare for entrance. The whole life we anyway do clinical practice. इधर भागना, उधर भागना, उधर भागना, इधर भागना. अभी तो आराम से शांति के साथ पढ़ने वाला वक्त है. PG medical entrance preparation days. So enjoy this wonderful honeymoon. Don't rush yourself. Don't feel that और क्या होगा, results कुछ भी नहीं होगा. शादी हुई तो प्रेगनेंसी होगा, प्रेगनेंसी हो तो बच्चे पैदा होगा, बच्चे पैदा हो तो उसको स्कूल भी जाना पड़ता. स्कूल भी जाए तो वो पढ़ेगा या नहीं पढ़ेगा मालूम नहीं. अगर पढ़े तो किसको शादी करेगा वो. अरे पूरा जिंदगी परेशानी परेशान. The only happy time, doctor. Now is the happy time. So enjoy, download the Incus app, 999 rupees. You get every essential knowledge which is required. You get 800 video content, 800 hours video, 2000 HD videos, question bank, flashcards, full scale grand test, quiz tournaments. Just 999 rupees for 3 years. Make all your friends, hundreds of students download every day and are joining. Some are not believing. अरे 999 rupees में इतना सारे चीज मिलता है या नहीं? मिलेगा क्या? पूछेगा. Knowledge is free with Dr. Murali Bharadwaz. Good luck. Study well for INI CET. And once more, we will meet tomorrow with a quiz tournament. Let us see who is going to be the winner of 500 rupees cash prize. Good night.